human papillomavirus is well known because we've been able to address this through vaccination. It still remains important because it's on a voluntary basis. And so people need to be educated about why this is important. Girls who are young need to be educated and vaccinated. There needs to be sex education. There needs to be more condoms. The reason for this is that the cancer-causing HPV strains are predominantly sexually transmitted. Circumcision does help. Next, women over 30 need to be tested for HPV. Okay, that's the next step, to identify those who might be more at risk. And so that's where the PAP and PCR and HPV screens are coming in handy. With the HBV, the hepatitis B virus, infant immunization is what is recommended by the World Health Organization. And they found that most of the diseases passing on when children are very young, often just after birth. And that really does indicate that we need to pay careful attention to this. So in some parts of the world where there's chronic disease, where HPV is endemic, 85%, most of the HPV infection, 85% of the infection that's being passed is happening at birth. And so we might get the wrong idea that this is predominantly being passed sexually. Actually, 85% in those endemic areas are being passed at birth from mother to baby, all right, which tells us that we need to promote infant immunization. Okay, next there's also antiviral treatment. So what's interesting is that in 2017, they were starting to notice that interferon, ribavirin were useful. In 2018, they started mentioning that there's some resistant strains. And so lamivudine, resistant strains, lamivudine was the first line treatment, but then it became entecavir and tenofovir, diazoxil. And alternatives were talbivudine and adofovir as alternatives because they showed lower drug resistance. HCV. So there is sofosbuvir and newer antiviral therapies that can help reduce the spread of HCV. Bhattacharjee and colleagues, in their 2021 article of virus diseases, they list many HCV antivirals that are available. However, although many drugs are available, the cost does remain prohibitive for widespread use in low-income countries. And the other problem is that there are many side effects associated with them. Regarding the Epstein-Barr virus, again, education is important. But then there's antivirals. And it's also important to prevent the spread of HIV because weakening the immune system makes it difficult for people's immune systems to fight off these viruses. Okay, EBV is associated with Burkitt and Hodgkin lymphoma, as well as nasopharyngeal carcinoma. Kaposi sarcoma, herpes virus, may be passed in saliva or semen. But it's mostly those with HIV that are suffering, all right? So in other words, treating the HIV protease inhibitors might help them regress, might help their condition. Speaking of HIV, by the way, people might say it's not carcinogenic, but up there I have HIV-1. It has direct oncogenic effects on top of the indirect impaired immune system that I just mentioned. And all subsets of lung cancer, Engels and colleagues have pointed out, arise in excess in those with HIV. It's not just explained by smoking. And so there's a synergistic effect between smoking and the chronic inflammation that comes from repeated lung infections. All right, so HIV compromises the immune system, and the immune system compromised, there are infections, which causes inflammation, and that inflammation is carcinogenic. There's a multiplicative effect with this virus. All right, on to bacteria. Famous Helicobacter pylori, causing gastrointestinal cancer, and it can be treated with antibiotics. Okay, that's the important thing to understand. Also diet can help. And then there's these liver flukes. You know, what are they doing? The blood flukes, they contribute to bladder cancer through inflammation and generation of reactive oxygen species and nitrosamines. We'll be talking about them a little bit in the upcoming slide. And then there's the blood flukes associated with colorectal cancer. All right, so I just mentioned, did I mention bladder cancer? Blood flukes associated with bladder cancer through inflammation and generation of reactive oxygen species from the schistosoma hematobium. And then there's the ones associated with the strains associated with colorectal cancer, schistosoma japonicum and schistosoma mansoni. All right, these ones are infecting people a little bit more in Asia. About 15 million people in China, 35 million people in the world are also infected with liver flukes. Okay, and this goes all the way to Thailand and some parts of Russia. It's important not to drink or enter infected water. Even entering the water, even if the water is on your skin, infected water, carrying these flukes, they can go through skin. A simple treatment might not get rid of them. Chlorination, for example, or a simple boiling filter is required. I suggest boil and filter.